Good morning, everybody. My name is Josefina Alvarado Mena. I'm the CEO of Safe Passages and Youth Ventures, and it's my pleasure to welcome everybody here this morning to Madison Middle School. We'd like to open up this program with a blessing, a Polynesian blessing dance by the Madison students.
Hello, ladies and gentlemen, staff and students, guests and families. My name is Benicia Rivera, and I am the Student Body Vice President for the new Madison Middle School. This is my third year. I have started here as a sixth grader and watched the school change for the better. These are changes that the staff and student have benefited from. The schools went through a major construction change, and we have watched the floors being changed to lockers being painted, and our students' behavior change for the better, and our academic scores rise. Now we welcome our new student health center named by the 8th grade students, the Madison Health Center. This clinic will be great for our school and community because some of the families struggle with health and dental needs.
Change is painful. Change can't evoke pride. What I'm happy to say is change has come to Madison. We understand our purpose here in Soprani Park. It is to awaken and support our community's future leaders. I personally believe their future has endless possibilities, and I'm glad and proud to lead this team. We serve 326 students on this campus daily. We offer before and after school programs to better prepare our students to compete. We offer Saturday school programs to our most needy academic students. We extended our school day to keep our students off the street. Our endeavor since the beginning was to meet the needs of the whole child. The Madison Health Center is in partnership with Alameda County will help to expand those services to our students for years to come. I have to say, I am the kind of person who loves quality, and I refuse to give somebody something I don't want. So I'm happy to partner with Alameda County as they begin this partnership with our students. I want to thank some of the same individuals that Benicia commented on. Our feeder schools, our community, our school nurse, Juanita Daniels, has worked extremely hard. The services that will be offered to our students include dental services, nutrition services, not just for our Madison community, but ultimately to our feeder schools, which are Brookfield, Soprani Park, Esperanza, and Korematsu, and Lina Wilson. And ultimately, it will be opened up to the community. So although it's opening today, in the next couple of days to our Madison students, ultimately, we will open up these same services to our community.
I'm also a board member of Safe Passages, have been for a long time, and so this clinic has been a long time dream of mine. And some of you young people may know I have a little slogan for being there, new dreams, new ways. And so I'm here to talk to you particularly about your dreams. I grew up in a family not unlike yours. Even though my family's been here 100 years, my mother was an immigrant. My mother did not speak English. For other students, our family was very, very, very poor. And when I was young, I actually was told I couldn't see a doctor and I couldn't go to the dentist unless I was in pain. And what I knew when I later grew up, and my first job out of college, working my husband through medical school, was that we adopted a middle school next to our hospital. And what we found is maybe 25% of the kids needed glasses. So that if you can't see the board, how can you learn? Another 20% of the kids had dental pain, and like me, my mother wouldn't spend the money to take me to dentist until my teeth hurt, and you know that's how you lose teeth, and you're older, you don't have teeth. And so it was really important for me when I became a school board member, because I learned in New York City that once we helped these kids, that they did better in school. That, you know, if you take good care of yourself, you're going to learn more. You're going to be happier, you're going to be healthier, and that's probably the most important thing for your future. We were able to open this clinic, and people say, okay, well, that's nice, it's a new clinic. But why we were able to open this new clinic is because the city of Oakland, the county of Oakland, and the school district have had this partnership. We didn't seek them, they sought us because they see us working in a different and new way. And with the budget cuts and the issues that are happening in the schools, we who work in government have to break down the walls and work together. We have to use our money smarter and better. I'm very proud Tony Smith's not here, but Tony Smith and I had a joint cabinet meeting between the city and the school district this week. Was it earlier this week or last week? Earlier this week. And we came up with some amazing ideas of how to share things and maybe save some money and do a better job of serving your community. So this was not an accident. This is very special because in the city of Oakland, the county health department, the school district, and the city works in new ways.
We're so pleased to invite all these folks into our neighborhood to see what we have. And we want to share some of the good things that we have. This health clinic is a well-deserved, well-needed health clinic. And it took a lot of collaboration and a lot of begging and a lot of knee scarring. We want to thank folks that have been in this community for a long time that never gave up on this dirt called James Madison Middle School. We want to thank our council member Larry Reed, who has consistently helped this school out. I remember the day that Dr. Taylor walked in. She walked in and found our computer lab stripped. Somebody came in and took all the computers, like the week before school started. Councilmember Larry Reed went into his pocket and made sure there were computers here within a couple of months.
Council President Reed could not be available today because the time moved for the event, and he chairs the Rules Committee. But just elaborating on the comments that Representative Spearman made, we have 3 schools in this community and a huge community to look after. The city has made a huge investment, the county's made a huge investment, and these types of collaborations will help our children's future. So we appreciate and honor all of the work that's been done by all of the people here, and it's about raising expectations. It's about raising expectations, and that's what the work is about. And so again, in the interest of time, I'm going to be short, but I just want to thank all of the folks that worked so hard to bring this about, especially Dr. Taylor, Safe Passages, Elev8, Philanthropies, the County of Alameda, and everyone else. And all of the youth here, please take advantage of this. This is an investment in you. Please take advantage of it because this determines your future. It's not just about looking at health disparities, it's about looking at the underlying causes. And in these communities with these types of collaborations at multi-levels, this is what it takes in this economic downturn. So again, we appreciate all of the collaboration. It's a lot of hard work. Thank you very much.
And I need to make a quick comment. On my way in this morning, I met a staff member here, Anidra, who runs the after-school programs. And she doesn't know it yet, but she's also a staff of the clinic. Because actually, young people are healthy. If you take a look at the epidemiology or the things that hurt young people, it actually has very little to do with doctors. In fact, the 3 leading causes of death of young people 12 to 24 are homicide, suicide, and unintentional injury, or CARS. Right? Actually, what this clinic does is bring people into a supportive, caring environment where they can access the health services necessary to achieve their birthright of the ability to thrive, not just survive, but thrive. This is actually a new vision of a supportive service infrastructure for schools. And it isn't actually done with the supportive philanthropy, though, as we're so grateful for the supportive philanthropy. The business model behind this clinic is actually a unique collaboration of public sector entities. The vast majority of the operating budget of this clinic is sustainable indefinitely. About 70% of its operating budget is generated through the fees it collects for the services that kids and young people consume in the clinic. So this will be here forever.
Part of our work in public health is making a community healthy. So in addition to providing medical care, which we will be doing in this clinic, we also have to work on prevention. and work with community members. And it was so great this morning walking in and seeing so many members of this community here that have been part of our work since 2004. In fact, Madison was one of our partners when we had an activity called House Calls, and we brought public health staff and our medical staff and provided a day of free medical care, and we went door to door and surveyed the residents of Sobrani Park to find out what they wanted from us to help them make them healthier, make it a healthier community. And we've been working in this community since then.
This is a very important event because it actually demonstrates the significance of collaboration. This is not any one entity's product. It is the product of the city, the county, the school district coming together with public partners, with private partners, with foundations, with nonprofits, with the community, with the school to make this a reality.
The people of Oakland have been so generous with their dollars. They've actually funded almost $800 million in facilities improvements. They've continued to put their money where their mouth is at and support this community, and it's hugely important. This is one of the toughest neighborhoods in Oakland, and has one of the most beautiful souls in the entire city. And what the district has done here in conjunction with the city and our other partners is show that you don't have to abandon tough areas. That the transformation that's taking place here is just nothing short of amazing.
This clinic is community driven. The services that we're going to be providing are services that the residents told us they wanted us to provide.
Exactly.
We will also have a community advisory board, which will provide guidance and direction for this wellness center.
There have been lots of obstacles in the past, but we're here to make sure that this community is supported. And they're here to support one another. The Public Health Department is here to bring everyone together to support one another and make this community work for everyone.
This is a wonderful, wonderful idea for the community. I love to thank Dr. Taylor. Ever since Dr. Taylor took over Madison Middle School, it has changed for the best. This is one of the best middle schools in Oakland, and we appreciate the school so much, and the health center, Mayor Quan for bringing it here. We appreciate all the progress that has changed this community. It's bringing all this community in as a family.
When this really opens, I'm going to come and get a checkup and get my teeth cleaned and everything, because I feel this is a beautiful thing for our community, because there's a lot of underprivileged children here that don't have wealthiness, or they have to pay for medical or health or dental things. So I think this is a very good thing for our school and our community.
Ladies and gentlemen, welcome to the Madison